Hi, everyone, and welcome to our Zoom conversation series. This is something that we continue to work on our YouTube channel for Senior Vitality. Today's episode is going to be talking about health portals, and this is specifically MyChart. This episode is going to be led by Angela, and she's going to take us through this PowerPoint presentation and give us all the ins and outs when it comes to MyChart. Just for introductions, my name is Philip, and I'm the project coordinator at Curry Senior Center for this program.
I'm Angela, and I am the Wellness Program Manager at Curry Senior Center.
Hi, and I'm Lauren. I'm the Senior Vitality Assistant at Curry Senior Center.
Thanks. So thanks for joining us for this episode, and I'm going to let Angela take it from here.
Great. Thank you, Philip. Hi, everyone. Thanks for watching our video. Today, we're going to talk about MyChart, which is also known as an electronic health record or your medical record or a health portal. There's lots of different names for the same thing. So we're going to talk about MyChart. It is one that is used at our medical clinic at Curry, but there are lots of other health portals, and your doctor or medical office that you go to might have a different looking one, but there's a lot of the same information in these electronic health records. So hopefully this will be helpful to help show you what your options are online. So we're going to get started. The first thing that you'll want to do is, for us on the iPad, there is a MyChart app, and you would download that from the App Store. And the first time that you use it, you're going to have to log in. And these are very private records. So you would need to ask your provider to send you a code to activate your access to your health record. And then you would sign up. So if you do need any help with that, our staff here at Curry are always available to help you with that. So on the home screen from MyChart, you're going to see a main menu and a lot of the sort of popular or most used options to click on for your electronic health record. And we're going to cover several of those during this presentation, but I would encourage everyone to explore the menu and see all of the different things that are available in these apps.
So I just wanted to ask, because usually when I go into my health portal, the first thing I want to see is all my providers in one place, all of my doctors, so I can contact them, reach out to them. I was wondering on MyChart how you can access that.
That's a great question. So in the center part where you see the blue circle with the 3 white lines, that's your main menu. And once you click on that, I'll show you on the next slide, you can see your care team. So when you go into the main menu, under Find Care, you'll see View Care Team. That's going to show you all of the providers that you see that are linked to the MyChart system and who you can use MyChart to communicate with. And we'll show you a little bit later in this presentation how you can communicate with them. So our next slide.
And Angela, I also had another question. So I have a couple of prescriptions that I currently just use the phone to call in. Mm-hmm. Can you renew prescriptions on this app as well?
Yeah, that's actually one of the major time savers that people can use MyChart for. It sends an electronic request directly to your provider to request that refill. So you don't have to call in, go through a menu, try and leave a message. You can do it all online. And so you'll see down at the bottom of the menu here, you'll see request prescription refill. And we're going to show in this presentation a little bit more detail on that. So the medications that you take, that's also listed in your menu. And this will pull up the list of your current medications. And at the bottom of each listed medication, it'll tell you a little bit about the medicine, how you take it, when it was prescribed, the doctor who prescribed it, the pharmacy that you use to pick up your prescriptions, and also an option to request prescription refill. So you would tap that request button and you'll see it hovering there also in the green to request refills. And that's how you would request it online. So it's pretty straightforward. And it does direct you to the right medicine that you want to get refilled. Okay, next slide is More information about requesting your medication refill. So once you select the one you want to refill, let's say I wanted to refill my Montelukast, which is an allergy medicine, I can hit that request refill button, and then I get a green button at the bottom which says next. It takes me to another screen and it says, okay, this is the one you have said that you want to refill. How do you want to pick it up? The option is to pick it up at the pharmacy. Potentially there would be another option maybe for delivery or mailing if that was an option. It tells you your pharmacy information, and then you hit that next button again at the bottom. And then when you're done, it gives you sort of like a summary page to say, okay, you're requesting this medicine, this dosage, you want it to pick it up at this pharmacy. And then the last button that you would hit is the green button that says submit. That will send the request for refill electronically. Okay. So you'll see the final slide on medications is when it gives you a summary of your order and the green button to hit submit. That will send the refill request electronically to your provider and your pharmacy for processing. Philip, tell me your question.
So quick question. So obviously when we're talking about prescriptions, something that's always on my mind is allergies and other health conditions and things like that. I was wondering on the portal, the way to kind of make that connection between the two and access that information.
Yeah, great. So there is an area on the portal. It's called your My Record. So when you're in that main menu, that home page with the circle with the 3 white lines, you would look for My Record, and this would open a page that would show you 3 things. It would show you your allergies, your recent immunizations, and any health issues that you have. So I'm just showing here my allergies page. This shows any medicine that I'm allergic to, food, etc. And you can get more information on any of those. There's a little eye, it's kind of faint, but it has a little eye in a circle, and I could click on the word penicillin and it would give me more information about my allergy to penicillin on this page. So that's useful to have, especially when you see lots of different doctors and you want to make sure that all of your allergies and immunization records are updated.
So I have a question as well. I was just wondering if you had any concerns related to, I guess, your health records, if you could schedule an appointment with your provider here on this app as well.
Yeah, that's another one of the great things that the electronic health record offers is the ability to schedule appointments electronically versus having to call, talk to a receptionist or try and leave a message for your doctor. So I'm going to show you next how you would do that. So again, on the main menu, you can look for schedule an appointment. It has a little symbol of the calendar. And for the appointments, there is a green tab at the bottom, and you would tap that, which is listed as schedule an appointment. So that's the first step. So you would schedule the appointment for a future appointment. This tab will also show you your past appointments and has a link to something called the after visit summary. So if I went for a test at a hospital on April 14th, I can view the after visit summary by clicking on the blue words view after visit summary to see what those results are, what happened at that appointment. But if I want to schedule a new appointment, I would click the green tab at the bottom, and then the option that would come up next is to ask you, okay, which provider do you want to see? And not all of your doctors will be connected on MyChart. There is a lot of decentralization, so some providers are not all on the same system. So we'll show you the doctor that does use MyChart to make an appointment. Or if you wanted to come in for other specific reasons, you'll see that on the right-hand side of the screen. Now, always we would tell people in cases of an emergency, pain, shortness of breath, really serious medical conditions, please do not schedule appointments or ask for medical advice through your MyChart app, but instead call your provider's office or call 911 in case of an emergency. So let's say I wanted to schedule an appointment with my allergist. I would click on her name, and then it would take me to more specific details like choosing a date for my appointment. A calendar will pop up. It makes it pretty straightforward. You could choose a date, and you can filter the times or see when they have times available. And you can also put in a box some information about what topics you want addressed during this meeting. And then you'll see at the bottom of the page, there is that green bar. So you're always kind of looking for a green bar in MyChart, and that says send a request. So you're requesting an appointment. You don't know for sure if you're going to exactly get that, but what will happen is you'll get an email to confirm that. And I'm pretty sure most doctor's offices will also call you and confirm it. But you can definitely get a message sent back to you through the email that you've signed up on the MyChart app with. So that's a pretty straightforward way to request an appointment on MyChart.
So one question I had is, now that we're kind of shifting more into in-person appointments, I was wondering if there's some way to select whether you want an online appointment, like a tele-appointment, or if you want to come in person. Is there some way to do that?
There is, and that's another good part of MyChart, is that if your doctor is available to do what we call telehealth or televisit or e-visit appointments, you can request that as well. So on the menu button, you would see a request. It says request e-visit, and E is short for electronic, and that would imply that you would do it electronically or by video, so you wouldn't have to go in person. So you'll be taken to this page, which is where you would select which provider from a drop-down menu, and also just confirming your pharmacy. And then when you're done with that, the next button, once you fill in that information, the next button should turn green, and then you would tap it and it would be next, and then you would finish scheduling your visit that way. To do an e-visit, the next steps would depend on your doctor. Some doctors will call you directly. Some will do it through MyChart. Some doctors aren't able to do that yet, so they would work out the actual technology of doing the e-visit with you directly. And for any of our Curry community who want to explore this or do more of this, you can always make an appointment at our Tech and Wellness drop-in hours to come talk to a health educator about working on this or trying to set this up. And we'll also be able to help you with tablets or iPads to look at your health information online.
So Angela, if you had a question about your health and you didn't want to either physically see your provider in person or through an e-visit, is there a way you can just send a quick question?
Yeah, that's one of the real benefits of the app, is it's a quick way to contact securely your doctor in a way that protects your medical information and sends them the information directly. So I'm going to show you that next. And the way that you do that is using the messages function. So the messages icon, it's on your home screen. It looks like an envelope, and we're all pretty familiar with the envelope usually meaning an email. So it means kind of the same thing, but it's an email within the MyChart system. So it's not, you don't have the doctor's email address, and they don't send it back to your email. They send it through the app. However, with notifications, you would get an email saying you have a message in the MyChart system from your provider. Click here to access it. So even if somebody saw your email, they wouldn't be able to know what that email or that message from your doctor said unless they had your login information. So this shows you that you have an inbox similar to a regular email account, and it shows messages that you have from providers, and you would just click on them to open up the actual content of the message, to read it and to respond. So there's a way to respond to someone who has sent you some information, or to create a message and send it to your provider. So at the bottom, you'll look always for that green bar. You can hit send a message, and it pops up a thing to ask you, do you want to send a message about medical advice, customer service? Sometimes, depending on the health provider system, you might get more options, like send a message about prescriptions, send a message about test results, but this is the sort of a general pop-up. So you would click what you wanted. So let's say you wanted some medical advice about a medicine or a test result. You would click that, and it takes you to the next screen. And the next screen is where you would actually type the non-urgent message to your clinic. So it pops up the name of the provider. You would put a subject line like test results questions, and then you would type in the body of the message what you want to know. You may be reporting to your provider how you're feeling after a recent procedure, or how you're feeling after taking new medicine, or reporting something else that's come up. Again, this is for non-urgent messages. If you're not feeling well or having worrisome symptoms, I wouldn't only send a message through MyChart. I would still call your provider, especially if you're not feeling well. So type what you want to discuss. And when you're done typing that, there is the send button in the top right-hand corner, just like you would a regular email. Now that's going to go to your provider, and they ask usually that they're going to respond in a couple days. My experience has been they respond pretty quickly through the health portals. So that is a good option to get a quick message back.
And I wanted to ask you, because I saw that with test results, if there's some way on the portal to access, the results from tests and labs and things like that.
Yeah, this is a great place where they store all that information. So in the main menu, if you look for the test results icon, it looks like a, chemistry beaker, I think is what they call that. And you can see all of the recent test results that you've had done. And then you would see a list of those tests. And then you would click on the specific test to see more information about what the test results were. So here's an example. Back in April, I took a COVID test. Thank goodness it was negative. But this tells me the date that I took that, where I did that, and what the results are. So this is useful, especially to keep track of things. Sometimes we take a few tests and we don't remember kind of where our results came out, but this keeps a record for us. And you can always contact your provider if you want to discuss test results by using the messages icon. And that's pretty useful as a way to review these things. Although most doctors will call you with test results as well. They won't just send it through the MyChart app. So those are kind of the main topics for MyChart. We talked about sending a message, seeing who your care team is, ordering prescriptions, and looking at test results. There's a lot of other things on the main menu. So I just want to reiterate that is something that you can go through and explore and try out each thing, see what your healthcare provider uses. And like I said, for different doctors, things might look a little bit different, but you can usually find a lot of the same functions. So for security, right, Philip, we always promote people logging out of their app just so that they keep their information private. So you would go back to the home screen, and in the top right-hand corner, you'll see either a little outline of a person, or you can upload a picture of yourself. That's sort of your main menu. And once you click on that, that avatar, we call it, that's a picture of me. Once you click on that, you'll see the log out icon on the bottom. And that is where you can securely log out of MyChart and close it, so that the next time you go to open it on your app, you would be required to put in your username and your password. And that's always a best practice to keep your information secure. So that was our presentation on MyChart. I think there's a lot of information there, and there's a lot of good stuff that you can use and talk to your doctor. And like I said, us at Curry, we're here to help you navigate this and learn how to use it if you are interested.
Thanks, Angela. And I just wanted to invite everyone to subscribe to our channel, to our YouTube channel, if you're interested in these types of videos, and check out other Zoom conversations. We have one about Amazon Fresh. We have one about video streaming. We love your comments, and hope you tune in.
Thank you so much. Thanks, Lauren. Thanks, Philip. Have a good day.
Thanks, Angela.
Bye-bye.
Bye.